In this video, I'm discussing again a recall communications, that is Wolff-Parkinson-White syndrome. It is come on 2019, 2021, repeated. It also recently come. That is Wolff-Parkinson-White syndrome, 2-month old. Task is explain the diagnosis and management to the father. So it is one kind of breaking bad news and also information giving scenario. There are two scenarios I'll discuss. So first, how can we start? IRCP, introduce myself, making a repo, taking the consent, telling my agenda, attendance, I will tell, and prime knowledge I'll ask. So suppose Mr. John, hello Mr. John, hello doctor. I am Dr. Emma, one of the doctors here. I guess you are uh, Sarah's daddy, isn't it? Yes. So it is really my honor to sit with a keen daddy like you and just to admire your efforts. You brought him in the right time and you saved his life. Okay, thank you, doctor. With pleasure, I am here to discuss with you some issues about Sarah's health. Would you like anyone to attend with us or shall I start? So about attendance, I am asking. I guess we can start. So tell me first, how much do you know about Sarah's health? So she is now stable. Father is telling and make a test for the electrical activity of the heart and I'm waiting for the result. Okay. So unfortunately, the electric activity test showed that he has a condition that is called Old Parkinson White syndrome or shortly WPWS. I'm really sorry for that. Father is telling what's that? I will explain for you everything, but to make myself clear, please follow me at this drawing. So we will draw a picture and we'll explain first what is Wolff Parkinson White syndrome. Okay. Then imagine with me. This is our heart. Normally, two upper receiving rooms and two lower pumping ones. We have also two rooms to the right, two rooms, and to the left. Two rooms to the right and two rooms to the left. Are you with me? So there are four chamber of the heart. We know that upper chamber is for receiving and lower chamber is pumping. And right side and left side there are blood tube. We know that. So normally what happened? The explanation is normally there is a spot here in the right small room. We call that it is the maestro of the heart. It sends orders to the another spot here. It is called the co-maestro. This co-maestro in turn give orders to these big rooms to contract, to squeeze the blood and eject the outside to the heart. Normally, one order from the maestro equal one heartbeat. Am I clear? So normal heart condition is that there is a dot. I will say that on the right chamber, it is called the maestro of the heart. There is another dot I will show him that is called co-maestro of the heart. So when this maestro give a signal, it go to the co-maestro and heart beats occur, circulations occur. So one order or from the maestro is equal to one heartbeat. That is normal physiology. Am I clear? You got it. But what happened in Wolff-Parkinson syndrome? One order from the maestro, instead of going directly to the co-maestro, it goes into the extra electrical pathway. So it gives the order to the co-maestro over and over and over. So as a result, the co-maestro gives order to the big rooms to beat over and over and over. So the final result will be one order from the maestro equal many heartbeats. So we will two picture we will draw. One is the normal physiology we are doing, maestro and co-maestro, two dot we will use, and another will extra electrical pathway we will draw, and we will tell that one order of the maestro, it goes to the co-maestro over and over, like extra electrical pathway will show. So as a result, what happened? One order of the maestro, it produce lots of beats. Okay. So is it serious? Father is asking. It can be serious if not treated. Luckily, we have discovered it and we will have an urgent meeting with the heart doctor. He will do a jelly scan for the heart to look if there are any in the structure of the heart or not. He may give him medications and may decide to remove this pathway by simple procedure. Okay. So these are the how luckily you have early discovered it and now treatment we are giving. The treatment we will discuss about the heart doctor. He will decide what he will do. He give us some medicine and a procedure by remove the extra electrical pathway. So when as soon as possible. Need the screening for his sister. We can do electrical activity for her heart. It doesn't run in genes, but children of the same family have increasing risk of having the disease. What I will do if it is happen again? If this happen again, you have to call an ambulance and you can do some procedure to decrease the heart rate, like make the message or ask him to breathe when he closes his mouth and nose like this, or you can put ice water bag on his face. So we'll tell that again if it can be occur, they come to the emergency, of course, and we'll give them some advice to do. Like what happened, they close their mouth and nose. They will try to take the breath, and also ice can be put on his face. We can give that. These are summary trusted website, leaflet, support group, will as usual. Some other questionnaire, can I take whom? This will decided by the heart doctor, or he may prescribe for him. Maintenance therapy will prevent the recurrence of the attack. Like immense ice face into the ice water 15 to 20 seconds. Then Valsalva, if the old, take a breath and hold it. That is Valsalva may take the breath and hold it. We have to take avoid some trigger like alcohol, caffeine, excessive exercise. This should trigger. And diagnosis by doing the electrocardiogram, and after giving medicine. Adenosine is the medicine, and heart will be converted to normal sinus rhythm. These are, and also some question they ask like, but if attack is severe or occur while sleep, Holter monitor lies with the school. He have to wear bracelet and take emergency plan card. Summary leaflet support group. Another old Parkinson syndrome come like father is very much annoyed at the beginning because we have given water in the face. So father is annoyed. How can we handle this line? I'm apologizing to do immersion of the child face in front of you. I know you are annoyed to see that by your eyes. We have to tell one of our colleagues to stand with you at that time to explain for you that we did it. It is necessary for saving his lives, as you saw. Without doing this, unfortunately, we might lose him at this moment. This is a critical situation. So we tell that I'm really apologizing that we immersed your child face with the water, but it was an emergency situation for saving the life. It was a treatment purpose. We do that. So what is the accessory bit? It is an extra heart muscle tissue passing between the upper chambers and the lower chambers present since birth. Fortunately, it is not a problem in structure of the heart. So what is happened? Electrical impulse normally pass from the upper chambers to the lower ones, and the lower chambers has a rule to slow down or limit the electrical activity to a low rate. But by adding extra pathway that will add to the heart rate and add up the heart rate. Well, this condition can do racing of the heartbeat, dizziness, chest pain. This causes management. We know that the definitive treatment is procedure done by the heart doctor. But first of all, there are saving measures. As so, immersion of the face by cold water. Second thing is to wear bracelet. We should avoid the trigger stress, some medications and some herbal supplements. Medication to control the heart racing in emergency situations like adenosine and amiodarone. Referring to the heart doctor and preventable medications. What the heart doctor will do? I'll arrange a meeting with the heart doctor to discuss with you the definitive treatment. It is about to remove the accessory pathway. We will use a tube through the blood tube called catheter. That catheter will send a type of energy called radio frequency to destroy this accessory pathway, and that procedure can cure the conditions completely in majority of the children. So these are repeating two communication come. I tell you, old Parkinson syndrome, very famous. Thank you.